So just about everyone has experienced the rare occasional heartburn symptom, but someone who can describe the frequency of heartburn symptoms that they have, whether they experience it on a daily, weekly, or monthly basis, and who's had that over several years, is someone we'd consider with chronic heartburn. The statistics say that about 44% of American adults will have heartburn at least once a month, and about 18% will have heartburn once a week. It can be across any age group, but we know that as we get older, we see higher rates of heartburn symptoms, and we do see more problems in older men, and particularly overweight and obese older men. Classic symptoms are experienced in the chest, either as heartburn, which is a burning sensation behind the breastbone, perhaps as regurgitation, which is the sense of food or fluid coming back up into the esophagus or to the back of the throat. Some will experience chest pain, which of course has to be distinguished from cardiac or heart pain. Some may have chronic cough, hoarseness, or chronic sore throat, which may be a little bit less typical symptoms. Some may just experience swallowing difficulty, which can be an indication of severe irritation of the esophagus, or even the development of a stricture or narrowing or a tumor of the esophagus, which could have developed as a result of long-standing heartburn. Barrett's esophagus is a condition in which a portion of the lining of the lower esophagus changes from one type of tissue to another. That tissue is a little bit less sensitive than the native lining of the esophagus, but the major harm is that that tissue has some precancerous potential. The presence of Barrett's tissue in the lower esophagus increases the risk of esophageal adenocarcinoma by 30 to 125-fold relative to patients who don't have Barrett's esophagus. If someone has had acid reflux symptoms or heartburn symptoms over a very long period of time, they shouldn't consider that nothing, and they should discuss it with their primary physician as to, number one, whether treatment is required, and number two, whether they should undergo an upper endoscopy study to determine whether or not Barrett's tissue is present.